Malaria remains a major public health concern globally, especially in Africa, where it counts for about 95% of the deaths globally. It is against this backdrop that the Ministry of Health has come up with new response to tackle the epidemic in the most affected districts of Uganda.
Starting this weekend, we are going to spray all homes, and this time with the chemical which used to work very well. As you know, this epidemic partly happened because the chemical we have used in the last 2 years has not performed very well for various reasons. So we have reversed it. We are using a more effective and more acceptable chemical to the community.
More than 17 districts are to benefit from the indoor residue spraying and distribution of treated mosquito nets.
The spraying in 8 districts. They are Palisa, Kibuku, Bodaka, Namutumba, Bogiri, but there are other districts for the first wave of mosquito nets, up to 17 districts, including some which are not receiving residual indoor spraying. Okay? In Busoga and a few in Bunyoro, including Kakumiro and Kibale.
Indoor residue spraying is one of the key interventions recommended by the World Health Organization in preventing malaria infection, but is a very expensive exercise.
For these 8 districts, residual indoor spraying alone is going to cost over $15 million. We have received most of the support from the US government through USAID and implemented by ABT Vector Links. Mosquito nets altogether are going to inject up to $120 million for all over the country.
Dr. Opigo also noted that the government will start the implementation of malaria vaccine at the end of 2023. This will strengthen the efforts to prevent, control and eliminate transmission of malaria in Uganda.
Uganda has been allocated about 1 million. Just you remember how the COVID vaccine was rationed, and as a result, the eligibility, the most at-risk people are going to be prioritized. We have prioritized a new birth cohort, so it's not going to be available to everybody. And we have targeted areas where there is a lot of severe malaria and malaria deaths. So we hope to protect up to 300,000 children per year. So we would like to use the opportunity to introduce the vaccine, strengthen the systems, get community acceptance of it. But we expect a very good community acceptance. People actually demanding it. A malaria vaccine has been long overdue.
Zahara Abigaba,